Hi, my name is Dr. Shruti Nadiga, and I'm talking about self care for medical students, doctors, and professionals to prevent burnouts, depressions, and suicides. My friend recently told me about a postgraduate doctor who self injected anesthesia and died by suicide in India. Doctors going through burnout and depression is a topic close to my heart, so I wanted to know more and I Googled. And I was shocked to see that just in this year alone in India, there are at least 10 medical students who died by suicide. And that too, it was just in the first page of the Google search, and I didn't count beyond. And my heart goes out thinking about how much suffering these young budding doctors went through and thinking about their families. These are young, empathetic, intelligent people who came into a system thinking they will help others, but into a system which is so harsh that it sucks spirits out of them. So many things could have led to their deaths. Harsh system, people, psychological, emotional burnout, physical burnout. And most seniors in the field are so numb themselves, they are not really sensitive and understanding to the budding doctors' challenges, or even people who are in the system for a long time. I went through some burnout in the medical school and I had no idea what I was going through. I didn't talk about it, nobody else was talking about it, nor was given any knowledge what are the signs, symptoms, etc. And looking back, I'm sure some of the people who existed in the system at that point also suffered silently. Even then, I was appalled at the stigma mental health had among medical professionals. It's ironical and sad. I really want to change that hush hush and suffer silently attitude. Because we are in a profession where we support people, societies. Isn't it ridiculous if we don't support ourselves and our peers? The support system should start from the first year of medical school. It's like if your compassion doesn't include yourself, it's incomplete. Same holds good for supporting ourselves, our peers, while we are supporting larger societies. Just to name one or two scenarios, even first year could be nerve wracking for so many people, and the anatomy labs. And while I consider divine bodies helping people to advance knowledge, not all come from medical backgrounds and people who have already seen some kind of suffering. These are harsh human conditions, and different people respond differently, and there's nothing to be ashamed of, sorry about, or weak about responding and wanting support. Different people need support at different point in life, in their practice, so we need to understand taking support is a sign of strength, and we should encourage that. And I would like to mention some ideas or strategies for self-care and building that support system. And the building support system could be, again, from a multiple layers. It could be personal, it could be pure, it could be professional support. And I acknowledge that this is kind of a band-aid approach till there's a larger system betterment in the system. But here it is. When it comes to personal support, please develop your own ways to deal with the shocks, stresses that you may go every day and face in medical school and in your practice. That will help your future practice as well. When I say personal support, different coping strategies, you may be good in writing a journal, or something you can record yourself and stand in front of a mirror and talk to yourself on how things affected you on a particular incident, or each day check in with yourself for a few minutes at the end of the day in the evening, or go before going to bed, how you are feeling and how certain things has affected you and how you can better your response while helping yourself, and if there's any point in helping others to respond better. And if anything like music, art, sports that can take your mind off even an hour per week can be a huge help. If doing personal strategies like this helps, that's great. But if there's something that you need to talk to somebody else, and yes, please have appropriate channels, or even prior identify a few friends seniors, colleagues who could guide you for right resource. Doesn't mean you can expect resources from one person or be a counselor, but you can always take their support to, get guidance to where can I go, what can I do. If it helps, even personally, identify your family member whom you can lean on, given that they can understand what you're going through and have the maturity to support you. This is more of building your peer system. And hostels could be one of the best places to start this. When many students, for dinner and after dinner, you go out for walk or sit and talk and chat, you can always have a consistent group where you talk to each other and understand, what incident brought out what kind of response in you and how you could have handled it better. Or if you're already better at it, that's great. Maybe your strategy will help someone who is yet to face that incident. This is what we can call it as peer support, right? And there could be some scenarios where you genuinely need some professional help. And if you could afford it, of course, private counseling. If not, in the same college, you can just reach out to some psychiatrist or psychologist or even sometimes student support team. If they're working well, they can even support you to get you the right resources, something or the other. I also acknowledge that sometimes it's not as simple as we say, but we can always try our best to help ourselves in some form or the other, or to an extent, if not entirely. My heart really, really goes out to the family members of these young budding doctors, and I really feel we shouldn't let their demise go waste. We need to learn from it and prevent further burnouts and suicides and depressions. I wish all the budding doctors and doctors who are in the system for a long time, please know that you need not suffer silently and you're not weak. You're going through some tough scenario systems that could be detrimental sometimes. Please also know that you are more knowledgeable than an average person in the society on how to get help and even what that help means to you. So please use your intelligence and energies to help yourself. And if needed, don't hesitate to take a break or even quit the field than considering to take your life. No matter what you do, you're still going to support people and societies. So you are unique and you are the priority. There could be another doctor, but not another you. So please help yourself and peers when needed. Thank you for watching.